Self-Management Network Scotland, Iona McCann Art in Healthcare. Self-Management Awards Self-Management Through the Arts 2024.
I'm Iona from Art and Healthcare. We were nominated and won in the Self-Management for the Arts category. So just to tell you a wee bit about our work, it's a great opportunity. So thanks for inviting us today. So at Art and Healthcare, we exist to make the benefits of art available for health and wellbeing. And we do this in a couple of different ways. We've got a collection of artwork that we make available to health and social care settings. We've got some of the collection behind me. And that's to make these spaces more welcoming, provide a distraction, and sometimes wayfinding even. And we also do art workshops for health and wellbeing, so practical art activity. And that's the area of work that we were nominated for and won. So we've got, can I get the next slide? Sorry. These are our three main projects. Oh, back one, please. There are three main projects: Taking Art Home, Room for Art, and Caring Spaces. So Room for Art takes place in Edinburgh and is social prescription project. Taking Art Home is all online for people with long-term health that find it difficult to leave the house. And Caring Spaces is our programme for unpaid carers as well. So next slide, please. I'm going to show you some images from our projects. The next one's from Room for Art. So Room for Art is kind of pop-up art studios, I would say. People get referred mainly from community link workers, but from other third sector organisations, and have a range of reasons why they're referred. Might be long-term health, mental health challenges, might be quite lonely and isolated. And people come along, find out what they're interested in, and an artist works with them on different kind of activities. Our sort of approach is to get people to kind of explore, experiment, and play with art. A lot of people come to us with a certain idea of what art is or can be. They might have learned that at school. So part of what we have to do is kind of get them to unlearn, what art can be. So in these Room for Art workshops, you might have somebody working on clay over here and somebody doing textiles. This particular image was for an exhibition we did. It's being safely transported, as you can see, a knitted vase. So folk find out what they're interested in. That's kind of long-term support. Next slide, please. This is from our Caring Spaces project, working closely with partners, Vocal and carers of East Lothian. Tends to be a bit more structured. The carers come up with the things that they're interested in doing, and they work together as a group, very much about connecting with each other, sharing experience, and kind of getting in touch with that identity outside of caring that they have. I think they're doing plaster casts and jelly plate printing, this little corridor exhibition that we have in this image. Next slide, please. And this is from Taking Art Home. So this started a project to support people with long COVID, and it's now widened to just anyone with a kind of long-term health condition that finds it really difficult to leave the house. And the artist that runs this, Jenny, it's very much about bringing the outside in a bit. So she might take them herself. She might record outside sketching, or she might, on an online group, take them on a webcam to Venice or something where they might do some drawing, or they've been up a tree doing drawings in a kestrel nest. And this was a session where it was a work from a collection on a roller coaster. And one of the participants was really into Disney, and they were talking a lot about the Glasgow Garden Festival. So they were doing like a drawing, trying to get it all connect up in this one roller coaster was in this session. Next slide, please. So what we find from our participants is it really does work, that people find connection, they're able to share more, new friendships are formed. They very much find kind of strength to cope, or kind of feel more hope through the workshops, and develop tools to help them kind of self-manage health and well-being through art. And it's also about improved mental and emotional well-being, so find it more relaxing, improved mood, and they might feel better about themselves. Next slide, please. Thank you. So where we work with people, this is another image from our collection by the artist Jane Hislop. And I think it's quite a good analogy of these sort of roads. And we all have those kind of bumps in the road, as the little mountain region would be there. And we're kind of working with people that are maybe just about to kind of reach a sort of rocky patch. Maybe they've just had a diagnosis or just become a carer. Or might be working with people that are right in amongst that. Some people in crisis point. Some people may be coming out of that, but still need that support and connection as well. Next slide, please. And yeah, so we know it really works. We've had challenges along the way, and one of them is getting more support for people that we work with. Sometimes when people are referred, especially with our social prescription project, it's been quite challenging to refer back in to get them other support or signpost out. So there's these kind of broken links sometimes. But we have been lucky to get self-management funding last year to look at different ways that we could provide support. And one of them has been through peer support and having a peer worker in the workshops and developing peer volunteers as well with some of our participants, which has been great. But the road at the moment is very rocky for us as an organisation, just to be purely honest. Kind of, if we're talking that road analogy, we're hitting a bend. We don't know what's at the other end of that bend. So a few of our projects currently will be running out of funding at the end of March. But next slide, please. But we are very hopeful. This is our artwork delivered safely. We are very hopeful and looking at different kind of ways. And having the award for us was just great to come at a time, help with morale in the team. And really, we're not good at shouting about what we do, as many in the sector are. So it was a real opportunity to celebrate ourselves and share that with the team. I've managed to take, I mean, I don't know if I can wave it about, it's quite heavy, but I have managed to take the award with me today. But it's great to have that in the office and as a little, reminder, keep us going at times as well. Yeah, that was me.